Good evening, Team Whiteman. Hopefully this is working this time around. I am Colonel Daniel Diehl, the 509th Bomb Wing Commander, and your host for tonight's town hall. First, apologies that this is my first town hall. I've been in command now 2 months. I know that we've had a few things happen around the installation that you all probably had questions about. We've had a few things on our plate here on the installation, so this was the earliest that we could take the time to do it. So thanks for your patience. The purpose of tonight's town hall is really to answer whatever questions you have, but in the process of generating those questions, we first want to talk to you really about the current COVID status, both on installation and off installation, talk to you a little bit about vaccines, and then really take a look at some of the things our mission support group has to share with you concerning everything that's happening as we go back to school. As we go through this, please feel free to put your questions in the sidebar there on Facebook, and we've got some folks here in the room who will make sure that we get those questions to the appropriate subject matter experts. And tonight we actually have a fair share with me, and I'll let them introduce themselves when they get up to the microphone. But for now, let me just give you a preview of who we have. So we have Lieutenant Colonel Dees, the Healthcare Operations Squadron Commander, with us tonight. We've got your lead Public Health Emergency Officer, Captain Patel, the 20th Attack Squadron Flight Doc, Major Markey, the Chief of Aerospace Medicine, Major Parker. We also have the Mission Support Group Superintendent, Chief Arcuri, and everybody's favorite, the Command Chief of the 509th Bomb Wing, Chief Jason Hodges. Really quick, we led the way for the Department of Defense by about 2 or 3 days in our mask mandate. For that, my apologies. However, we all have to do our part really to get in front of the Delta variant as it was surging through the area. My primary concern for our population set is ensuring that we've got the proper bed spaces in the local community in case any of our members actually need those bed spaces. And I also want to make sure that we can still answer our nation's call when it's needed. So we do pay attention to mission impact. We were seeing a rise in COVID cases on the installation, and that's what led to our mask mandate. Right now, the only thing that the Department of Defense is actually directing the mask mandate on federal installations within federal buildings. So we are following the Department of Defense guidance on that. The only thing we're doing a little above and beyond is active duty, where we've asked them to wear their masks and socially distance to the max extent possible off installation, again, just to help protect our mission and our people to the best that we can. Many of you have probably seen the notification from the Secretary of Defense about the possibility of a mandatory vaccine. Right now, that's the latest guidance we have, but we again have some experts in the room to talk to you about the vaccination. And I know there are a lot of questions concerning what ifs about the vaccination. Right now, we don't have any published Department of Defense guidance concerning a lot of those what ifs. Feel free to ask the questions, and if we have the answer, we'll make sure we share it with you. But please be patient with us if we tell you we don't have that guidance yet. With that, I will pass it over to Lieutenant Colonel Dees, our Healthcare Operations Squadron Commander, for the next section. Thank you.
Thank you, Colonel Diehl. Hello, everybody. I am Lieutenant Colonel Jessica Dees, the 509th Healthcare Operations Squadron Commander and one of Whiteman's Public Health Emergency Officers. At the 509th, we are committed and all in supporting the COVID-19 response. At the 509th Med Group, we are offering the COVID-19 vaccine, Moderna. Vaccines are the safest and most effective way at preventing moderate to severe illness and deaths due to COVID-19. The Immunizations Clinic offers availability Monday and Friday from 7:30 to 11:30. Appointments are not required but are preferred. To make an appointment, please call 660-687-2188. Moderna is an mRNA vaccine. It is approved for emergency use for adults 18 years and older, and it consists of 2 doses given at 28 days apart. Side effects of the Moderna vaccine include pain at the injection site, mild fever, small muscle pain, and also headache. And I experienced all those after my second injection. This is completely normal and a response from your body that we are building the immunity it needs to combat the virus. Studies show that the Moderna vaccine, as well as the Pfizer and the Johnson & Johnson, provide adequate protection against the Delta variant, which is the most frequent variant found today in our cases. The Centers for Disease Control and Prevention do not recommend one vaccine over the other. If you prefer to receive the Johnson & Johnson or the Pfizer vaccine for free off base, we support your decision. This includes our active duty service members. We just ask that you bring your immunizations card to the immunizations clinic so we can update your record immediately. The 509th Medical Group also offers COVID-19 testing by appointment only, Monday through Friday, 8 o'clock to 11:45 and 1 o'clock to 3:30. Due to high demand, we are only testing beneficiaries of Whiteman Air Force Base who are symptomatic, close contacts of a COVID-19 case, and those on official travel. Per the Centers for Disease Control and Prevention recommendation, we are testing fully vaccinated personnel 3 to 5 days after the last exposure to a COVID-19 case. We recommend those who require testing for leisure travel receive testing off base for free. Thank you for your time. We look forward to seeing you at the 509th Med Group soon for your COVID-19 vaccine. And now I will turn it over to Captain Patel.
Thank you, Lieutenant Colonel Dees. Hello, everyone. Good evening. My name is Captain Tanviben Patel, and I am the Public Health Officer for Whiteman Air Force Base, as well as the Lead Public Health Emergency Officer. Some things I wanted to mention today is what public health does and why it is important for our community members and our beneficiaries of our base to be able to call us. So public health's goal for combating this pandemic is to stop the chain of infection, is to be able to get the contact tracing started early and be able to continue our mission and be able to help our beneficiaries and our members in the community. Our community around us, Johnson County and Pettis County, are severely overwhelmed with their contact tracing. So it's important that as our public health office here at Whiteman, that we help out our community and be able to help them with this process as they are overburdened with that contact tracing. So when to call public health? We want everyone to be able to call us when you're getting tested, whether it's on or off base. Call us if you've been in contact with anyone that has tested positive for COVID-19, whether it's someone in your work center or your family. Call us even if you have questions about COVID-19, even if it's about the vaccine, how to get the vaccine, where you can get tested. That's what public health is here for, is to be able to be that resource to get you connected to the right place and the right person. Some differences between what quarantine and isolation is. Quarantine, you are on quarantine for 10 days from your initial exposure to a COVID-19 positive patient or someone that might be presumptive positive. Isolation starts when it's the onset of your symptoms, when you have tested positive for COVID-19, or if you've never had any symptoms and you're asymptomatic, it's going to be from the collection date of when you originally got collected for the test. We also offer a lot of guidance on forced health protections for our DoD members, as those guidances change frequently, especially with travel. So it's important that if you're going to be traveling, whether it's official or unofficial, that you give public health a call so we can be able to give you the right and correct information, especially for overseas where they're going to have different guidances, different rules, and we want to ensure that you are having safe and effective travel. Next, I'll pass it over to Dr. Markey.
Thank you, Captain Patel. I'm Dr. Markey. I'm the 20th Attack Squadron Embedded Flight Surgeon. I also work at the 509th Med Group in the Flight Medicine Clinic. I also work off-duty in a small community ER just north of Kansas City. I keep a pulse on COVID because it's a part of my everyday life, on and off base. This spring, as the vaccines rolled out, COVID case numbers were declining in Missouri, and like most places, we lifted the mask mandate for vaccinated people, per the CDC guidance. Around Memorial Day weekend, however, Lynn and Marion County, just to the north of I-70, went into a state of emergency as the Delta variant hit Missouri. I knew something was wrong when our small community hospital was sending testing supplies across the state. Week after week, I continued to watch the cases spreading rapidly across Missouri, and shortly after 4th of July weekend, Branson and Lake of the Ozarks started lighting up, consistent with last year's spike. Then Springfield and Joplin declared a state of emergency. And finally, Kansas City, Columbia, St. Louis, and our local counties, Johnson and Pettis County, started to see case numbers rising rapidly. When the mask mandate lifted in May, the expectation was that the community would continue to follow guidance for unvaccinated individuals to mask up. Approximately 3/5 of Missouri is unvaccinated at this time. Do you see 3/5 of the community wearing masks? I certainly don't. Masks aside, my point is, it's no wonder that Delta variant spread like wildfire. And it's no wonder that our major hospital centers are once again with long wait lines, limited beds, and are straining due to the flood of COVID patients. But there is hope. We have ways to protect ourselves from COVID. The most effective method is a vaccine. And we are lucky here in the United States to have free and abundant supply for vaccination. The Pfizer vaccine is approaching FDA approval, and the Moderna vaccine is close behind. Vaccines are safe and effective. 97% of the patients filling the hospitals and dying from COVID right now are unvaccinated. We know that the vaccine reduces your chances of death, hospitalization, and something we refer to as disease morbidity. Morbidity means complications of disease other than death. You hear less about the morbidity of COVID. You think the death rate's only 1.7% in the United States. I'm not going to be one of those people. But 50% of COVID survivors report a decreased quality in life. 15 to 87% of patients have fatigue lasting greater than 3 months. 1/5 of patients report impaired memory, depression in 1/4 of patients. Studies are now showing long-term loss of actual gray matter tissue in the brain. That's surrounding the olfactory and gustatory systems, your sense of taste and smell. We're also seeing imaging patterns comparable to Alzheimer's and other neurodegenerative conditions, not to mention the increased risk and occurrence of strokes, seizures, and an ascending paralysis known as Guillain-Barré syndrome. COVID affects the heart. Early studies from Germany showed us that the original variant caused inflammation and damage in the heart muscle following infection in over 85% of patients, regardless of disease severity. This increases the risk of future heart failure and other cardiac complications later on. I have cared for airmen on this base suffering from some of these complications. I certainly wouldn't want anyone I care about to get COVID, and I definitely wouldn't want anyone to die from COVID. But COVID is starting to touch all of us. First, it was our diseased and elderly, but now half of the hospitalizations are in the age 20 to 60 group. And kids, now too, are being affected by the Delta variant. There have been breakthrough cases, that is, cases in vaccinated persons, but those are not the patients filling up my ER. If you were in a gunfight, wouldn't you want a bulletproof vest? The vaccine is like armor, and the battlefield is right here in our community. The vaccine not only reduces your disease severity, it helps reduce the spread. Vaccinated individuals are far less likely to spread COVID to others, and the spread is what keeps this pandemic going. Missouri is the United States epicenter of Delta, a variant of COVID that originated in India. Delta variant is especially concerning because of its increased transmissibility. Delta results in higher viral loads, and higher hospitalization and death rates. As I mentioned, Delta is now affecting children who are unable to yet get vaccinated. The more opportunities we give this virus to mutate, that is, the more infections that occur, the more likely we'll create variants like Delta that spread both more readily and cause more damage. We will reach immunity eventually, but wouldn't you rather do it the easy way with a vaccine than roll the dice with the next COVID variant? Please get vaccinated, slow the spread, and protect the children who are not yet eligible for a vaccine. Thank you. I'll turn it over to the Chief of Aerospace Medicine, Major Parker.
Good evening, ladies and gentlemen. Thank you, Major Markey. As she stated, my name is Major Victor D. Parker III. I am the Chief of Aerospace Medicine / SGP here at Whiteman Air Force Base. I am also a physician and flight doc here at Whiteman, MD to be exact. However, I am uniquely qualified because I was pediatric trained at Richmond at VCU. This qualification gives me a unique perspective on vaccinations. As you can guess, vaccinations were a big part of my academic criteria in pediatric population and vaccinations as a whole. Given this knowledge and experience, I am very confident to advise the general public alike to receive this vaccination. But why? I'll go over that briefly in a little bit, but essentially it is life-saving. I can state that confidently. The stats are already eloquently provided by Major Markey, so I will not belabor the point. However, I cannot emphasize enough to do this. As you know, preventative steps are very important. Washing your hands, social distancing when possible, wearing a mask, as the Secretary of Defense has indicated we should do, but receiving the vaccine is the most important, I repeat, the most important thing to preventing disease. Why? Receiving the vaccine, I feel like causes a lot of anxiety in people, particularly nowadays, particularly when you reference the COVID-19 vaccination. But why is this? And to some degree, from a lay standpoint, I understand. It is, after all, a very new or relatively new genetic vaccine. The rumors of the side effects have been spread rampantly in the media, and how quickly the vaccine was produced in comparison to other vaccines. On a superficial surface, I can understand. However, we as practitioners believe in this. We as the medical community believe in this. All of the people before you have taken this vaccine, including myself. I want you to take a step back and think about this. Let's take a large step back. Have any of you out there in the crowd heard of smallpox, measles, polio? Do you even know what these things are? I will venture that most of you don't know what these are or have even seen these diseases. This is because vaccinations have largely and or wholly eradicated these diseases from the general population. I cannot emphasize that enough. If you take a large step back and see the effects of vaccinations in our society, vaccinations work. I cannot advocate for them enough. They protect our society as a whole. If that's not enough to influence you to get vaccinations, I would advise you to keep in mind that the president and or the FDA will make vaccinations a mandate relatively soon for military members. And I would implore you to undergo vaccinations as to avoid long waits and scheduling conflicts. As Major Markey indicated, there are differences in the vaccinations, and I will not belabor the point. However, I will state that the 3 vaccinations that are approved by the FDA here in the United States have 2 different ways of working. Slide, please. Pfizer and Moderna work in similar ways. They work by placing a messenger RNA, which is a piece of genetic material, in our human cells via the vaccination. Once in our cells make the protein spikes associated with the COVID-19 vaccine, and our immune system recognize those spikes and fight the virus. As indicated by our FIO and Major Markey, these vaccinations are safe and effective. So what's the bottom line? Let me appeal to the sensibilities of people. The bottom line is that receiving this vaccination will, in essence, make you a better military member, protect you and your family, benefit the mission and the installation as a whole. Again, I thank you for your time. I hope you have a good evening.
Good evening, everyone. I'm Chief Master Sergeant William Arcuri. I'm the Mission Support Group Superintendent. So to give you a little background on what the Mission Support Group does, most of the folks who came up here earlier were talking a lot about you as an individual and your health. The Mission Support Group is a lot of things on the installation that aren't necessarily your health, but that do impact you as a community. So we handle engineering, communications, contracting, and I'm really going to talk a lot about one thing in particular tonight, which is our force support, and some of you may know it as services. So everyone who lives, works, and frequents this base is our military family. And all of our family, we want all of our family to be safe. We want all of our family to be able to work and operate on the installation. And in that, we want this installation to stay open. So our key goal here is to keep the installation open. Now, part of that is going to depend on the health of the community, and that's where we really do need your support for a lot of matters. We are keeping facilities on the installation open right now. For instance, the Youth Center is still open. The Child Development Center, also known as CDC, that is still open. We do have the on-base school is going to be open fully, and there's going to be a mask requirement for the students there. Many of you know that the off-base schools have a mixture of mask requirements. Speaking with the school liaison officer, currently Sedalia has a mask requirement and Clinton has a mask requirement, and today Clinton did announce that they're not going to have football season this year. However, the other schools are operating different ways, and we'll hear and get that information out through the school liaison office as they put forward different regulations and rules for the student population. Now, here on the installation, we feel it's very important that everyone abide by the rules that have been put forth, not just by the DoD, but also across the installation. We do have some places that in order to keep them open, we really do ask that you listen to the staff about keeping your mask on when you're in the facility, as well as some areas that we may not want people to go that they normally may be able to just go through freely, and that is to make sure that we're maintaining capability. For instance, at the CDC, the Child Development Center, we recently had a positive case, which was very unfortunate. However, due to the protocols that were in place with masking and social distancing, we did not have to shut down the CDC. We were able to keep it open. We only had to close one classroom for a period of 10 days. So situations like that is what I'm talking about when I say I'd like everyone to please continue wearing your mask when you're in our facilities, and please respect and listen to the rules that the staff are giving you. Now, we're also going to try and keep a lot of fun activities going throughout the summer and into the fall and into the winter. A lot of you were out there at the Summer Bash recently, and you may have noticed we did have some mitigation efforts. There was masking, we were doing some things for distancing, but there were still a lot of kids out there enjoying the water slide, enjoying a good burger, and just a good time getting together as a community. We want to keep those things going, and we're going to need everyone to follow those mitigation efforts so we can keep doing that. 1 month from today, we're planning to have our Air Force Ball, and you will see some mitigation plans that do come out, and it will be dependent on things like real-time data and the local community, and we're asking for your support with those things. And then getting into the fall, we're looking forward to a great time at some Halloween events, Thanksgiving, holiday activities, and again, some of these we will be wearing masks, we may be doing some social distancing, but the important thing is that we want to keep this community open for our entire military family. In order for us to be most effective at work, we want the entire family to be engaged, safe, and supported throughout and beyond the pandemic. We do need your support to be successful for this, and I promise you we are trying to make sure we keep this base open for all of you. And now I'm going to turn it over to our Command Chief, Chief Hodges.
Thank you, Chief Arcuri. Hey, good afternoon, Team Whiteman. I tell you, just before coming over here, I was over at the elementary school. I was over there for day one, opening up the school, the night to allow Damien to meet his teacher. And all I could think about as I looked around at hundreds of families, hundreds of young kids, and think about, how stressful of a year this has been. There's so much going on in the world right now. And I know that many of you are stressed out as well. I've heard it from you. I've heard the conversations as I've walked around this base and listen to the concern in people's, listen to the stress and the anxiety that people are feeling from thinking that they're getting ready to have to do this mandatory vaccine. And the thing that I would tell you is, with everything that's going on, I ask you, focus on the things that you can control. Focus on the things that you can do to benefit Team Whiteman. Focus on the things that you can do to make sure that you are ready and that Team Whiteman is ready to get out there and execute their mission. Focus on the things that you can control to make sure that you're taking care of your teammates, that you're making sure you're taking care of your kids, your family members. I tell you, it is important. This vaccine is important. This vaccine can make the difference between life and death. And we would not ask you to go out there and get this vaccine if we did not think it was safe. I've actually had the vaccine myself. I had 0 side effects. I've encouraged everybody in my family to go out and get this vaccine as well. And I encourage you to do it too. I tell you, we're depending on you. We're counting on you. Every single member of this team is important to us. We care about every single member of this team. Myself and Colonel Diehl spend a lot of time talking about ways that we can take the best possible care of this team. And when we're talking about Team Whiteman, we're talking about every single member of this team, active duty, guard, reserve, spouse, child, civilian workers. It does not matter. You are part of this team. You are part of this family, and you're important to us. And it's important to us that you are safe. So I ask you, please set aside your fear and step up to the plate and do the right thing and get that vaccine so you can help take care of all of us. Thank you, and I'll turn it back over to Colonel Diehl.
Wow, we've got a very good selection of subject matter experts here. Chief Hodges, awesome words. Many of you have not heard my spiel, and I apologize for not yet making it out to all the spaces. But I really do view the military, my military team, as part of my extended family. My wife, my daughter, and I all really view this as our family. So, what you're hearing right here are those things associated with how we look out for each other in a family. So, man, I really wish that, we could have a town hall where we weren't thinking about COVID. Unfortunately, it's still the name of the day. Many of us probably think back to, the summertime and the spring as we were all walking around unmasked, and it was a breath of fresh air. Right now, our best hope of getting back there is the vaccine. So, again, thank you all for tuning in. Right now, I think is the time where we can really spend some time and go back and forth with you. We've had a few questions that have come in while we've had our folks up here talking. So if it's okay with you, I'll start going through some of those, and we'll revisit with some of those experts as we talk through these questions. All right, so the first two, the first one here, will the vaccine become mandatory for family members, civilian employees, and/or contractors? The difficult part with that question is, as I mentioned in the very beginning, we are still awaiting really how this policy is going to look from the Department of Defense. So I would ask you to be patient with us as we move forward, and as we get that guidance, we will make sure that guidance is disseminated to the best via all the channels we have to everybody. All right, next question is along the same lines. If the Pfizer vaccine receives FDA approval, is that the only vaccine that will be mandated? Again, we're hearing rumors, all sorts of rumors, and right now what I'd prefer as far as this official channel goes with you is to keep you with the no-kidding data, truth data as we know it. And right now, we're still awaiting that guidance from the Department of Defense. Chief Hodges was the first question up here, so I'll delay his return to the microphone for you. This question, why are fully vaccinated individuals still contracting COVID-19? And for this question, I'd ask Dr. Markey to come back up and answer.
All right. So we know fully vaccinated individuals are having breakthrough cases. The difference is these vaccinated individuals are not getting as severe disease or symptoms. The vaccine takes this disease from a deadly virus and knocks it down to a cold. Our immunity, to answer your question, is variable from individual to individual, and there are new variants out. So when our immune system prepares a defense against a virus and that virus changes, our defenses also have to change. So part of it is due to the variants. But again, vaccinated individuals are not the ones getting hospitalized and dying. Their viral load is significantly decreased, and they have a 60% reduction in transmissibility with infection. Thank you.
Thank you, Dr. Markey. Next one, I'll bring Colonel Dees back up for you. Can civilians get tested at the medical group?
Thank you for the question. So bottom line, yes, but it depends. We can test our GS civilians, and we can also test our dependents of active duty service members. If there's any questions about other civilians being tested, I would refer you to the phone number 660-687-2188, call Public Health, and ask specifically if your situation in that civilian category, if it is not the dependent of an active duty service member, if it's not the GS civilian, if it's another category, if it falls in line with testing. Thank you for the question.
Thanks, Colonel Dees. This next question, are vaccines safe for individuals who have already had COVID? For this one, I'll bring Dr. Parker back up.
Good evening. So are vaccines safe for individuals who have already had COVID? Yes. It is actually indicated that they can receive said vaccine 2 weeks after infection. It has been proven effective to prevent reinfection. Thank you for the question.
Thank you, Dr. Parker. Next question, why do vaccinated individuals need to wear masks? For this one, I'll bring Captain Patel back up.
Thank you for the question. Why is it important for vaccinated individuals to still wear a mask? Well, as I'm going to echo what Dr. Markey has said, we are not anywhere near approaching herd immunity. We have very different variants that are out there, and this virus itself is still mutating. And we know that masks from various studies, whichever research you're going to look at, there is a 60% reduction in transmission. With this Delta variant, we know that it's highly transmissive. The R0 is between 5 and 9. That means that if you're standing in a room and you have 10 people in that room, you can infect between 5 to 9 people in that room, compared to the original variant, which was closer to 3 to 5. There are asymptomatic patients out there, those that have had breakthrough infections, where they might not even know that they are even infected. The symptoms are very mild. They can be anything from a sore throat to a headache. And you might not even think that it's COVID. We also have other diseases out there. We've seen that we've had a wave of RSV, and we have had a wave of flu that's coming through right now. So it's important to think about some of those other diseases and not just focus on COVID, because all of these different diseases mimic each other. So it's hard to tell whether someone has COVID, they have RSV, or they have the flu. And it's important for us to protect our most vulnerable population, which are our immunocompromised and our children that can't get the vaccine at this moment. Thank you.
Thank you, Captain Patel. Does the 509th Medical Group do antibody testing? Colonel Dees, come on up.
Hello again. That's a great question, and actually one I hear a lot. So currently the CDC does not recommend using antibody testing to determine if you have had a previous infection. And to kind of describe what antibody testing is, it's used for surveillance purposes. So large organizations, say like a large university, they'll go through and they'll test a certain population to see of that population who has potentially had COVID-19. It's not a great test, for there's a lot of false positives because of the cross-reactivity to other coronaviruses. So we at the 509th Med Group do not utilize antibody testing because the CDC does not recommend it. Thank you.
Thank you, Colonel Dees. If COVID-19 vaccines become mandatory, what happens to service members who refuse to get vaccinated? Again, a great question, one we're really looking forward to having an answer for you, but right now we are still awaiting the Department of Defense guidance concerning all the specifics surrounding a mandatory vaccine. Next question. If a person has already had COVID, do they need the vaccine? And for this one, we'll bring Dr. Markey back up.
All right, so to repeat that question, if a person has already had COVID, do they need the vaccine? So the answer is yes. So our natural immunity when we have COVID does not induce enough of an immune response to create a lasting immunity. So we're seeing antibodies drop off around the 90-day marker when you are infected with what we call the wild type COVID. Now with the vaccine, we expose you to a piece of that virus that we know will induce immunity. And then we re-expose you with that second dose, and that creates a lasting immunity. The Moderna vaccine, we're seeing still a 93% efficacy rate at 6 months versus natural infection, which again, drops off around 90 days.
Thank you, Dr. Markey. All right, here's the next one. Is there any anticipation of PT test delays because of increased cases? And for this one, we'll bring Chief Hodges back up.
Hey, thank you, Colonel Diehl. So, team, so PT tests have already started back up, and there is no anticipation of us turning PT tests back off. The thing that I would do is I would encourage you to run what I call the Dr. Dre checklist daily. The Dr. Dre checklist, that is diet. So make sure you're eating healthy each and every day. That's important. Take care of yourself. You know, and these things are important when you're looking at stress and everything else that's going on in the world around you. You know, take care of your diet. Make sure you're getting plenty of rest. Make sure you're getting some exercise in every single day. That is absolutely important. So every single day when you wake up, run that Dr. Dre checklist. And if you do that, you're going to notice that your resilience is going to be a whole lot better. You're going to feel a whole lot better, and you're going to stay healthier for your teammates. So Dr. Dre checklist, get out there and get after it. PT tests are coming.
Team Whiteman, this has been an amazing summer. I've been here with you about 2 months. We've done some amazing things. We look at what the A-10 side of the house and the 442nd has been doing. Love seeing them fly. You see the T-38s airborne all the time. We've got B-2s going everywhere. We have a lot of mission happening at this base, and it's something that we should all be proud of. The last piece I will give on COVID is that, you know, if you look at the mitigation measures we've been doing, what we are trying to do is arrest the COVID impact on this installation with just putting in the basics. Mask wear, socially distance. We are maintaining organized sports with no mask wear. We're still doing gatherings. We're not talking about using the term max capacity. So all we're asking is do your part as far as the socially distancing and mask wear. Go get a vaccine. And the sooner that we get most of the base immunized, the sooner that we can get back to the freedom of not wearing that mask. Those are all the questions we currently have right now. We will make sure if you want to watch this video after we're done, please go back, put your questions in there. We'll make sure that we've got people monitoring it. And if it's things that we can answer, via social media, we'll get those answers back out. If it's things that you want to see in the next town hall, we ask that you include those in there as well so that we can bring in the right experts to talk to you about it live and then converse based on questions you input in the next town hall. We will look, depending on circumstances, on how things go. It may be another couple months before we do another town hall, but we'll see. It's all based on what you want from us. So we'll pay attention to the frequency. If you've got inputs concerning that, please include those in there as well. Otherwise, I really thank you for tuning in to hear from us here at Team Whiteman, and we look forward to talking with you again. Chief Hodges and I and the rest of the team really look forward to getting out and meeting more of you in person. Thank you.